Kia ora, everybody. Thank you so much for joining us. Really appreciate your time this afternoon. We are going to give the other participants another minute or two before we kick off, but just a bit of housekeeping while we wait. We do have your microphones muted for now. You do have the opportunity to ask any questions at any point through the Q&A function. So at the top, looks like a little bubble with a question mark in it. If you click on that, you can just put any questions in that chat, and we will be stopping throughout the presentation to answer your questions. We do want it to be really interactive, but we do have quite a few people hopefully joining the webinar, so that's the best way for us to do that. So I'll have the team help me with that. Maybe we start with just a quick round of introductions, and then we can kick into it. So kia ora, everybody. My name is Flo. I'm one of the co-founders of Hendrix Health. Hendrix Health is a local New Zealand partner for Heidi. Been working with the public system as well as a lot of private dietitians and helping them adopt Heidi into their workflow. And I'm really pleased to have three amazing wahine toa with us today. Alice Gormack, Katie Lambert, and Lynn Lloyd. So I'll hand it over first to Katie to introduce herself.
Kia ora, my name is Katie. I'm a dietitian working in obesity management, both bariatrics and GLP-1. I work in private practice and I'm using Heidi. And prior to my private practice, I was using it with Alivia, formerly Mercy Ascot Hospital, as a bit of a trial within the team there.
Amazing, Katie. So glad to have you join us. Alice.
Hi, everyone. I'm Alice Gormack. I've been working with the Fertility Associates as a private practice dietitian since about 2013. And I also see non-fertility patients under Alice Gormack Nutrition. So I've been using Heidi for my private practice, maybe, I can't even remember, a year or two, since it was pretty early on, and I found it really helpful as well.
Kia ora, hi everyone, I'm Lynn Lloyd and I work in private practice now as a kidney dietitian, having left or retired from Te Toka Tūmai, Health New Zealand last year. And I've been using Heidi for about the same time as Alice, nearly 2 years. Certainly it's changed a lot over the time, but for me it was a game changer. The first benefit that I really noticed was how much documentation time it reduced. You know, the less note taking during the consult and also much less typing, and I'm not great at that. So that was a massive benefit for me. But as I learnt more about it and used it more, I saw many benefits and how it aligned more with dietetic practice. And I think I'd just like to share a few of those just to kick off the session. Firstly, I think because our consults are very conversational, we talk about a lot of things and they can go on quite long. Heidi is particularly effective in turning these conversations into structured clinical documentation very, very nicely. And I think that really is important for us as clinicians to get that done seamlessly. The other thing is, particularly because we like to have good relationships with the patients, is it improves their experience, the patient experience, because you're not having so much time taking those notes. And I still take notes because I just want that safety thing. And I also like to talk with the person, have some details there about nutrition problems and goals, etc. But you haven't got that frantic note taking. So you've got more eye contact and better conversation. It's more relaxing for the dietitian as well. The other particular thing, which it won't be any surprise to you, I was delighted that NCBT framework and terminology fitted so well with the Heidi, liking a structured template. So that's really important because it actually, if you have a NCBT informed template, you can actually organise the consultation to get a more complete and actually a greater quality and consistency of your documentation. The other thing, the final thing that I'd like to really share with you that I noticed that actually it can help show the breadth of dietetic care. So with an enhanced template, Heidi can really capture more than just the food and nutrient advice. But if you actually, for example, put in, instead of just intervention in your template, if you actually tease that out more and have the nutrients, have the education, the counselling, and even the coordination of care, with the right prompts, Heidi will nicely organise that, which is actually important, I think, for showing other health professionals in our letter the added value that we have with our consultations rather than just giving nutrition advice. Just like to finish because we've got a lot to cover, but just to, I think probably to highlight first up that the template is the key. And Heidi can do a lot of good things, but you do need to give it the good instructions and good context. And one final point I think that's really important is careful checking, and we'll talk about that because Heidi does make mistakes, and I've found that out. I think I spend quite a bit of time checking. What I do, which I've always done in my letters, is have when I send them out to the doctor and the patient, is actually have some statement in the email saying things like, if there's anything that does not seem correct, or if you have any questions, please email me. And occasionally someone will actually email back and say, oh, by the way, I got my information about IgA nephropathy from Leicester rather than Linker or something like that, whereas Heidi has made a mistake. So I think, you know, some people are very particular and they read everything that we send them. So that's quite a good option to do. But anyway, I'll stop there because we've got lots to do. So hand over to Flo to take you through Heidi.
Beautiful, Lynn. Thank you so much for that kōrero, and I think that sets the scene perfectly. I do want to kick us off with a bit of a whakatauki, if I may, which is whai ati ia te kaurangi ki te toho koe, me he maunga teitei, which translates to seek the treasure that you value most dearly, and if you bow your head, let it be to a lofty mountain. And this maunga is really all of us hopefully being able to use a tool like Heidi effectively and safely within our clinical workflow. Obviously, to get to the top of that maunga and hopefully having a beautiful view, there are necessary steps that we need to take to climb that mountain, and we can do it together here. And those steps are the learnings. And so, yeah, hopefully that sets the scene for today's session. I do want to start at the beginning, which is to actually explain how Heidi works under the hood. So Heidi is typically used by dietitians both in secondary care, so within the hospital setting, as well as in the private sector, in one of two ways. One, where Heidi is listening in the background of you having a normal conversation with your patients, what we sometimes refer to as an ambient scribing use case or a transcription use case. And then the second way that clinicians use Heidi is where they dictate, typically where it's only them present after the client or patient has left. And you can use Heidi for both of these modes. And there's specific settings within Heidi to optimize it for that particular workflow. Now, there actually have been a lot of debates recently. I think it was always very clear for most that when we do use Heidi in a setting where there is a patient present and their voice is being transcribed, that we should obtain verbal consent. And there's some clinicians who also move to written consent, and some clinicians have adopted additional changes to their practice management systems. For example, putting in flags when patients previously have consented to the use of an AI scribe like Heidi. Now, increasingly, there's also more discussion that we're having recently with the National AI and Algorithm Expert Advisory Group within Health New Zealand around consent settings for when you're dictating. In the past, it's been always that when you're dictating and the patient's not present, you don't need to seek consent. But it seems to be shifting somewhat. And because the issue is around whether the patient is okay with having AI process their health information. And so, yeah, the main three parts to consenting effectively are really to explain to the patient what the tool does, how data is handled, and giving them the right to say no. Now, in practice, we're finding less than 0.5% of patients actually do say no, but it is helpful if I could maybe share a little bit more about how data is actually handled, and to give you an example so that you feel confident and that you can use that in your own practice. So to explain how data is handled, what I should also explain is that there are really three main ways that you can use Heidi, that you can get access to Heidi. One is through a browser by going to heidihealth.com or scribe.heidihealth.com on any computer, laptop, doesn't matter if it's a PC or a Mac, if it's an iPad or a tablet or a phone, you can always go to heidihealth.com through your browser and you can use Heidi in your browser. We call that the web app. But there are also mobile apps for both iOS and Android, and there's some real advantages that they provide. I'll touch upon that later. The third option, which I'll also be showing you today, is that there's a desktop application that you can install on either a PC or a Mac. And one of the things that can do, which we'll be using later, is that it's very good at transcribing telehealth calls. So, for example, when someone's speaking through a Teams call, like we are here. And so we'll be using that. Now, it doesn't matter which one of those three options you choose. Data is always handled the same way. We only store the information for a very brief period of time within each respective application in an encrypted way before we then transfer it or transmit it, stream it, again in an encrypted way to the Heidi environment, which is currently housed in Sydney, Australia, in a cloud provider called AWS. And really all the magic happens inside this environment. So there are three main things that happen. Firstly, we turn audio into text, or we say we transcribe audio into a transcript. And so you can think of the transcript as the verbatim of what's being said. Actually, there's no summarization has happened yet. It's just verbatim of what was said. Now, in Heidi, you can then add additional information to what we call the session. So the session contains a transcript, but it can also contain additional information such as the patient's name, other information about the patient itself, and you can also add what's called context. So context can be things like prior medical history or a referral letter. In the emergency setting, clinicians actually use their phone, and this is one of the advantages of the mobile phone app. They use the mobile phone and they take a picture of the ambulance notes that come in, which come in as a printed document. And they take a picture of that with the Heidi mobile app, and it allows you to bring that whole ambulance note into your context. Obviously, for dietitians, again, it might be a referral letter from a GP or from another specialist, but that's really useful. And so what we do is, this is the second step. First, we turn audio to text. The second step is we actually de-identify all the information in the session. What that means is we look for things like names, date of births, NHI numbers, addresses, phone numbers, and we actually pull them out of the session. So both the transcript, but also the additional information that you've uploaded, and we store it in a separate place within that same environment with a digital key. And then we put placeholders instead into the document, into the session. So maybe instead of Alice Gormack, it might be Jane Doe. And instead of the actual address, it might be Sesame Street. Now, that is so that if anyone were to hack us, all the intruder would get are the de-identified transcripts and session details. So it's an additional layer of security. So that's the second step. The first, turn audio into text. Secondly, we de-identify all the session. And then the third step is really where the AI portions of Heidi come in. So we host multiple large language models or AI models ourselves. And it's The purpose of these large language models or AI models is to take the input, again, the transcript and any context, and turn it into a formatted output for you. And we'll show that to you shortly. Now, the bridge between the input and the output that the large language model uses, or the AI model uses, we call templates in Heidi. And that's really the secret sauce. So depending on the template that you select, you might get a multidisciplinary team meeting summary, or it could be a follow-up to a nutrition plan, or it could be enhanced nutrition care plan, and it's the template that defines the output. Now, those 3 steps: first turn audio into text, then de-identify it, then thirdly turn it into some kind of formatted output. Now, just before it comes back to you, what we do is we actually open that vault again with the patient identifiable information, with the actual name and the actual address, and we look for those placeholders that we'd put into the transcript now in the formatted output, and we swap them back around. So to you, it will look like it's got it right, but that's not how we store it. Now, the final step, and it's definitely the most important, and Lynn has also alluded to it. When it comes back to you, typically the results are pretty good, which can be a bad thing because it can lull you into a false sense of security over time. It does use generative AI, which does mean that it can get things wrong, it can miss things, and it is imperative that you as a clinician use it as a drafting tool. It will save you time. It will hopefully reduce like mental burden on you, but it is also a shift in your cognitive load. So whereas before you had to do your homework and do your notes yourself, now you have to learn how to grade homework, and that's a different skill. So that's something that it might take a little bit of time for you to actually learn, but this critical thinking skill is absolutely crucial in this day and age of AI, because we need it for all the tools that are yet to come. This is really the first of what will likely be many tools that can support us as clinicians. But yeah, it does need to be used in the appropriate way, which is that we review the draft notes before we then copy and paste it into our PMS, or if there's an existing integration, we might click the push button to then push it into the right place within our practice management system. Now, I've spoken for quite some time. Are there any questions about how data is handled within Heidi? Do we have any in the Q&A? Feel free to ask at any point, and then I'll come back to it at a later stage. That's no problem at all. So just moving on from that, an example of how you can appropriately obtain consent is on the screen in front of you. Again, the 3 main parts are: what does the tool do? How is their privacy protected? And thirdly, giving the patient the right to say no. I think you'll come up with your own style, and it'd be really great to hear from Alice and Katie and Lynn later on what they do. But for me, it's something along the lines of, kia ora, hey, before we start, I just want to let you know that I'm intending to use an AI-assisted note taker. It allows me to be more present with you. It actually does not record your voice at all. It just turns it into a draft note for me, which I will then review before placing into a medical record. Is it okay if I use that? Something along the lines of that. We had all kinds. One that I don't advise is a GP in Hamilton used to say, I have a new girlfriend. I absolutely love her. Her name is Heidi. She's doing all my notes for me, which was a bit chauvinistic. But one of his joker patients actually brought him a red rose for Valentine's Day to give to Heidi, which was kind of funny. But yes, please feel free to ask me any questions around that at any point. But I want to share, before we get into the fun part that you guys are all here for, which is the actual demonstration and tips and tricks and the live demonstration, I do want to share a little bit of research. Now, we are short of research in the dietetic space, so maybe after this, if there are groups of you who would be interested in doing some more research specifically around the dietetics use case, I'd be really keen to hear from you. But we have some research done in New Zealand, actually by Health Hawke's Bay PHO, across 50 GPs and 12 practices. Now, I know that some of this doesn't relate to you as well because these are 15-minute consults. I know you're doing longer consults. So I'll step a little bit past some of the findings around time savings. But I think there's some other really interesting findings in here that will be relevant to you. So yes, it did save time. In fact, it saved roughly 2.2 minutes per session for these clinicians across the 50 that were in the sample. Now, this is self-reported time savings, not stopwatch. But yeah, roughly 125 sessions for a GP in a week. So that's around 4.5 hours saved. Now, interestingly, the clinicians basically found that they were able to run to time more. And certainly from a patient's point of view, there was a patient survey done. They experienced it as well. So the clinic was running more to time. There was an improved overall satisfaction from the clinicians, and they felt that the clinician was able to focus more on them, which is one of the main benefits that typically we talk about with the scribing use case. Interestingly, while there was an increase in the understanding of the clinician note, that was not statistically significant in this sample. But one thing I do want to touch on and go into more detail is that in this particular study, we actually looked at, well, when I say we, I'm adorning myself with others' feathers because it's actually Health Hawke's Bay who did the research. But they were looking at whether an AI scribe can actually affect the way that patients experience the consult from a cultural point of view and cultural equity. And so interestingly, one of the findings was that, yes, definitely, there was more time within the session for the clinician to practice medicine the way that they really wanted to treat the patients the way that they wanted to be treated from a cultural point of view, whereas before they were often quite rushed and didn't have the time to engage in some of those cultural practices. In that sample, there was there's a subgroup of the clinics that had quite a large proportion of Māori enrolled patients, and especially with those, they felt that having that extra time to kōrero, to whakawhanaungatanga was really meaningful. And so from a patient's point of view, they did report that they feel that their cultural needs were met more after the introduction of the AI scribe rather than before. And we actually dug into that a little bit more and had a look at what were some of those key drivers as to why patients were feeling and clinicians were reporting that they're able to more culturally equitably treat their patients. And there's really three main pillars. So firstly, if you or any of your clinicians speak another language, so Te Reo or Hindi or Chinese, you can have a consult in Te Reo, Chinese or Hindi with your patient, and Heidi will still give you an English note. And that is a really great experience for those patients. But also think of a scenario where, for example, you might have a patient and an elderly parent. The elderly parent might only speak Hindi or Chinese. The patient might be able to speak English and Hindi or Chinese. It's a really great experience, and we actually trained these clinicians how to do this, to be able to create a patient-facing summary and then to translate that patient-facing summary into the language of the parent. And we found that those use cases was where the patients, and especially their family, felt like it was an amazing experience. So like if an elderly Chinese parent couldn't understand what was happening, but was worried about their daughter or their son, then having the ability to provide something to them, obviously having the patient there who was able to translate and make sure that it's accurate, both the English summary and then the Chinese. If you don't speak Chinese, because that's it, you definitely shouldn't just send a translated output if you can't actually verify it. Then that was an amazing experience. So the clinicians thought that that was really meaningful. Then secondly, Heidi has a capability to prompt Heidi, and we actually trained the clinicians to adjust these patient explainers to the needs of the patients. So for example, if someone had dementia or a learning disability, you could choose to adjust the patient correspondence to the third person and actually address a family member. So you could address it to the daughter of the elderly person and talk about their parent, and adjust it that way, or make it really easy to understand by constraining it to a second grade reading level. That's all possible. Another thing that we trained them on was for those clinics who had a high percentage of Māori enrolled patients, we trained them how to prompt Heidi, for example, by a prompt that said, explain to my patient from a Te Ao Māori worldview why they should manage their diabetes and take their metformin regularly. And it will give you a completely different perspective and a different approach. And those things might be the reason why some of your clients might actually engage with your care plan. If you can put it in the words that they understand and that they can ask questions of as well, that's been really helpful. And so that's the second pillar. And then the third pillar was that we actually worked with again that subset that had the high Māori and percentage enrolled population, and we included elements of Te Whara Tapawha into their GP notes. So it still had the main parts, which are typically subjective, objective, medical history, assessment, and plan, which is a typical GP note. But then we also included things like spiritual health and whānau and all these other elements that are more the holistic view of a patient. And so those clinicians that participated in that was not everyone, did feel that was meaningful. So hopefully this is helpful to you. I would love to do some more research in the dietetic setting, but yeah, I'm happy again to take any questions. If you like, please put them into the Q&A section. But otherwise, I'm happy to jump to the fun part, which is to actually show you Heidi now. All right. So this is Heidi. We're looking at the web version now, and I think the first thing that we should do is just have a look at the settings. And if you currently have a Heidi account, then you can follow along. It's a little bit like a Warrant of Fitness. So hopefully there'll be a few things that you can pick up. So by clicking on your initial on the bottom left corner, you can then open the settings. And there's a couple of key things that I want to point you towards. So firstly, on the left under account, you do want to make sure that your specialty is set to dietitian or to your actual role that you currently have. If you have Reiki practitioner or yoga teacher selected here, it will not work as well. That's because there are actually basically medical dictionaries behind each one of these specialties. You can imagine that a cardiothoracic surgeon might use the same three-letter acronym as a dietitian would, but it could mean something completely different. So you're giving it the context of who you are and where you are, and that actually helps Heidi a lot to do a good job for you. This state region setting is something that was introduced lately, so it might not be set for you. I think it would be very useful for you to actually set your state or region. It is important in the context of a new feature that Heidi has released, which is called Evidence, especially when we release the health pathways integration, because health pathways are different in different parts of the country. So a lot of the localization around evidence is driven by what you select here in the state or region. So I think those are kind of key things. Another thing is to check your date format, but for most of you, that should be fine. Now, you may not be aware, but this memory section is quite useful. So there are a couple of things here, features that not everyone knows about in Heidi. One, sometimes Heidi doesn't get things right. Let's say a suburb of Hamilton. Maybe that's consistently misspelled, but you happen to be in that suburb. So it comes up a lot. This is how you fix it. So what you can do is in the output, you can highlight any word, and there's a little menu that comes up, and one of them is a find and replace function. Otherwise, you can do it here. But what you can do is you can basically get a get out of jail free card. If anything doesn't render the way that you want to, you can create a rule to fix that problem here under the replace function. And also, we have got a thing called snippets, which are like auto text. So if you've got things that are repetitive that you want to drop into your notes, you can actually create some shortcuts for yourself here, and you can you can use that, for example, to create a normal finding and then bring that into your outputs. Know that you can create both the shorthand trigger, which is written, as well as a verbal trigger, but the verbal trigger actually does not work within the transcription session. It only works if you're dictating into your note at the end. So I'll show that to you when we get there. And then one really important section I think everyone should make sure is set up correctly is the default section. Now, firstly, we talked about Heidi being able to understand a variety of languages. If you typically consult in English, I still highly recommend for all of us to select both English and Te Reo Māori as our input languages, because then, when we remix our language as we do, and say things like kia ora, and I'd love to have a hui with my mokopuna about this before we actually move forward, then Heidi will understand that. So for all of you, I think that's one key setting. English and Te Reo. If you also speak French, just add French here as well. One thing that I sometimes see people get wrong is they put the second language into the output language. If you put Te Reo Māori in your output language, all your notes will come out in Te Reo Māori, and hopefully your Te Reo is better than mine. Then you can read that. But if that happens, just switch it back to English, and that's where you can fix it. Now, spelling. My biggest bugbear is we don't have New Zealand English, but Australian English seems to be the one that works best. You can choose to, if there's a specific way that you refer to your patients, you can set it here. It's often used by midwives, for example, because they like to refer to their patients as mama with M-A with the macrons over it. So you can define anything here and then refer to clinician as how you want to be referred to. From these ones, if you do have a paid version of Heidi, then you have an option to choose between the fast scribe or the best scribe. If you have the free version of Heidi, then you only have the fast scribe as the option. And the best scribe is better, so I would suggest choose the best scribe because it's not much slower and the output is a lot better. And for you, if you are technical, what that means is it's a more advanced underlying model with a larger context window. If you're not technical, best is better than fast. Now, one really important setting is to ensure that you have a default note template set up. If you don't have a default note template set up here, what will happen is that after each session, it will not generate a note. Instead, it will ask you which template you want to select, which is an extra step that you don't necessarily need. You want to choose the template that you use the most commonly. You can always switch it afterwards, but you want to use the one that you use the most commonly, and this is one that Alice and Katie have shared with me that we'll be using for our demo in just a second. Now, I won't go into too much detail around this section here because we can actually adjust it after we've created the output, and I do want to show you, but this is where you select that, where you can dial in how brief or detailed the note is going to be, as well as a few other settings. Now then, for some of you, maybe not for all of you yet, you will have access to this really new and exciting feature within Heidi, which is the Dictate Anywhere feature. So what this will allow you to do is, with a button press, a shortcut key, in my case, it's the right control key on my keyboard that I've selected, you can dictate into any field anywhere on your computer. For example, your email, or into your practice management system directly. And this is where you set up your input language here. And again, I would suggest you ensure that you select both Te Reo and English for that, which is fine. Just a couple of last things. We were talking a little bit about data and how data is handled. If you have the practice version or you're with Health New Zealand, I know some of you are with Health New Zealand. Maybe we should talk about Health New Zealand for a little bit. With Health New Zealand has got a version of Heidi called the Enterprise version, which technically is very similar to the practice version, but it comes with a special contract that Health New Zealand signed with us. It's got some extra protections. But from a Health New Zealand point of view, there's 4 main things that Health New Zealand really wanted to ensure that happens. So one is they only want to keep notes or any outputs in Heidi for 14 days. So in team settings, this is something that you can change. You can change it to only keep sessions for 14 days. If you're in private practice yourself, you might not want that, because you might want to be able to link sessions for before. But from Health New Zealand's point of view, that's what they made us contractually agree to, that it's only 14 days. Secondly, with Health New Zealand, almost all staff use their mobile phone, and mostly their personal mobile phone as their transcription device. They then move to typically a workstation on a web browser with the same username and password, and then edit their documents there or their notes there and bring it into the system that it needs to go to, or send it away to who it needs to go to. But because they use their personal mobile phone, they require multi-factor authentication to be turned on for all users. And they also require a patient consent prompt. So that's where you're actually prompted before you start the transcription to ask for verbal consent. And then they also require a content footer. So in this case, it was this note was generated with the assistance of generative AI, reviewed by the clinician with patient's consent. So under every note within Health New Zealand context, that's what it says underneath there, and it's configured in these team settings. Now, if you don't have a practice version of Heidi or an enterprise version of Heidi, this last one, the team content footer, you can't do, but you can still add it to your templates. And if you, under data management here, you can choose to automatically delete your sessions. You can also, under the display controls, turn on the consent pop-up here. So you've got the same options, but just with the practice version or the enterprise version, you can enforce it at a group level, and you can make it so that all your staff actually follow it. With the clinician version or the free version, it's something that each individual clinician needs to configure. Now, one last thing I'm going to show you before we get started is, remember how I talked about that you'd want to select your default note template? How do you get your templates? Like where you can actually find a template. So I'm going to jump out of here, and just know on the left-hand side, you've got a button here that reads templates. That's where you can access all the templates that you've got available. Now, a really great place to start, it will come with a couple of starter templates to get you going. If you select dietitian, there's like a dietetics note and others that it will be available here. It comes with like 4 or 5. But if you click this browse community here, you get to the Heidi template community, and then you can filter, for example, by specialty. So dietitian, and then you can see some other templates that other clinicians have created, where they're from. Maybe you're focused on weight loss, so a bariatric letter might be the right thing for you. I've actually pulled this one down, which is a client letter, and all you have to do is just click on it. You can see an example of what it looks like and the structure, and then if you just, in this case, it's already in my template. If you just click add to my library, then it will show up in your library. That's one way. The other way is that you can actually create your own template. So by clicking create template here, you can choose note or a PDF form, in this case, note, and then you can just write what you want. I want to create a follow-up nutrition plan for diabetic pediatric service. Yeah. And then a really good tip is to upload an example note. And then what will happen is Heidi will actually generate the structure for you. And I'll come back and we'll talk a lot more about templates in a second. But I want to get to the fun part. So what I'm going to do now is I'm actually going to switch to the Heidi desktop app for a second, because it will allow me to transcribe Alice and Katie, who are going to give us a little bit of a demonstration of a typical consult within Heidi. Give me 1 second because I need to create a new session. This will be a bit small, but I'll switch back to the desktop version in a second, and then we can get started. Now, Alice and Katie, would you like to unmute yourself?
Yep, I'm unmuted. You
Yeah.
good, Katie?
Okay.
Yep.
Okay.
Just give me 1 sec. Almost there. But yeah, maybe explain what you're about to do.
So we're pretending that Katie is my follow-up patient from a fertility standpoint. She had IVF and now she's become pregnant and she's come back for a check. All we're wanting to show with this is not every last interventional plan or follow-up that we're planning. It's more just to show how good Heidi is at just capturing, medications and supplements and the situation of the patient and a diet history. So that's the goal of this very, very quick session, which is not probably how either of us would run a real one, but we'll give you an idea.
Okay, and just one thing before we start, we do want to check this microphone icon at the top here that I'm pointing at, and we do want the green bars to be moving, because if they're not moving or they're red, then that means Heidi can't hear you, and then that's when tears ensue at the end of a 1 hour session. So that's definitely something that you want to check. In this case, I'm going to hit transcribe. Now, who's going to be the clinician, Alice or Katie?
Me?
Okay, Alice, it will prompt you to ask for consent, so maybe if you could do that one as well at the beginning, then we can jump into it.
So usually I will ask the patient, is it okay if I use a dictation service called Heidi Health to help me with my notes and my transcribing from the session, or help with my accuracy of my notes and producing a summary of the session for you afterwards. Is that okay with you, Katie?
That's totally fine.
Cool. We're good to go, Florian?
Yes, good to go.
So welcome, Katie. I understand that you have some good news following your frozen embryo transfer after your IVF treatment.
Yes, pretty exciting. So it came back positive. So yeah, really excited. A little nervous, but excited.
Yes. And how many weeks are you now?
9, I think.
Yes. And you've had
Yeah.
your early pregnancy scan with the fertility clinic?
Yeah, I had that a couple of weeks ago and that was all pretty good. So yeah.
Excellent. Have you experienced any symptoms with your pregnancy so far?
Funny you mention that. I was feeling a bit queasy this morning when I woke up. So nothing too much, just maybe just feeling a bit off. I've really gone off my morning coffee. It's a bit strange.
Yes, yeah. When we spoke last time, I had your height at 165 metres and your weight at 71 kilos. Is that still the same now?
I think so. I haven't popped on the scales, but I haven't noticed any changes.
Yes, that's fine. What medications are you currently taking, Katie?
Nothing at the moment. Yep.
Yes. And what nutritional supplements are you currently taking?
Do you mean like those pregnancy things? Well, actually, the GP did give me something. Is it iodine and something beginning with F? I can't remember. I don't know what it was, but it began with an F. And
Yes.
then I picked up some black thing. Had a pink label and maybe gold from the supermarket. It said it was for pregnancy, but I can't remember the name of it.
Okay. Yes. If you want to email me afterwards, that would be fine, or during our session you can go and get it. But usually the one starting with F would be folic acid. Does that sound familiar?
Yeah. That's the one. Little tablet, quite small.
Yes.
Yeah.
Perfect. Are you still taking the CoQ10 supplement that you were taking when you were having your fertility treatment?
No, you told me I had to stop that, so I haven't taken that since. Yeah.
Good. That's really good to hear. Have you had any changes to your nutritional intake, Katie?
Not really. I mean, I don't really like my coffee in the morning this morning, but no, pretty normal. Nothing noticed anything yet.
Okay, perfect. And have you got the food safety in pregnancy booklet?
No, what's that?
Okay, it's a booklet called Safe and Healthy Eating in Pregnancy, and I will send you the link to it. It's a good start for looking at food safety in pregnancy, where we have to be a little more careful with our intake.
Oh yeah, cool. Okay, that sounds good.
So if we run through a really quick diet history, that would be great. So what is the first, what time do you typically wake up in the morning, and what's the first thing that you would eat or drink?
Well, I've been waking up, no changes, just waking up about 7, and then, as I said, normally I've been having a coffee, and then some peanut butter toast. But this morning I really didn't feel like my coffee, so I just had a glass of milk actually.
Yes.
Yeah, and that would have been before I left for work this morning.
Yeah. So would that be what time roughly?
Maybe like, I don't know, 7:45, pretty quick. Yeah, ate it pretty fast.
And are you stopping for something between breakfast and lunch? Do you tend to have a morning snack at the moment?
No, I haven't been. I mean, I might grab a mandarin or something, but nothing as a rule, really.
Yes. And how about lunch? Do you stop for a regular lunch at work?
Yeah. We get a lunch break. So, and I've just been taking in leftovers from the night before.
Yes. Would it be a similar size to the night before, or would you have a smaller portion for your lunch?
No, it tends to be a bit smaller. My other half tends to take most of the food at lunchtime, so I just get the smaller portion. Yeah.
And any drink with your lunch?
Yeah, I really like a Coke Zero.
Yes. Okay. What about afternoon tea? Anything between your lunch and your evening meal?
I might grab, we've got a lolly jar at work, so I might grab maybe a couple of lollies if I'm peckish. Or we've also got a fruit bowl, so I might grab a piece of fruit like a banana or something.
Yeah. Okay. And what sort of evening meals are you having? Are you still having much of an appetite in the evening like usual?
Yeah, I haven't noticed much. We still do my food bag, so 3 nights a week. So that's working still pretty good. Just the my food bag for 2. So yeah, just depending on, sometimes those portions are quite big, so sometimes there's leftovers, and sometimes not.
That's probably plenty, guys.
Yeah, cool. That's fine.
Yeah. Thanks so much, team. Appreciate you guys. That's awesome. So let me just hit end transcribing here. And what will happen is, those 3 steps that we talked about, us streaming the audio to the Heidi environment, turning audio into a transcript, de-identifying the transcript, and then generating the note is what's going to happen. And what I'll do is I'll switch it over here so that you guys can actually see it. Sorry, I'll just go. So as you can see, you can log into any different browser. It will automatically show the session. In this case, let's have a look at the transcript. So this is the actual transcript. That's the verbatim of what was said. And the note has not generated, so I'll just regenerate it here. And then what I'd love for you guys to do is just check the output, and we're going to look for any errors or omissions or any missing parts. So I'll get rid of that, give you a bit more space.
Yeah, it's all looking good so far.
It's not good. I wanted a mistake so that we can actually talk about it. It does look pretty good. And what we can see here is actually it's quite a good template. It's something that Katie and Alice have actually worked on before, and so it's actually probably your template, Alice. And so it's quite neatly puts the information together in the right sort of way. Now, I do want to show you a couple of things that you can do with this. So one, if you click on this Goldilocks icon here, you can actually change the level of detail. And we've got these pre-configured settings. One is brief, detailed, or super detailed. Brief will bring in much more of like clinician shorthand and I'll just show you that now. Versus super detailed will bring in a lot more of the patient's voice. It's often used in mental health settings, for example, and uses a lot of patient quotes. So for most dietitians, they set it to kind of the happy medium to Goldilocks or detailed. What are you guys using, Alice and Katie? Do you know?
I think it's Goldilocks. Yeah.
Goldilocks? Okay.
I tend to use super detailed for mine.
Super detailed. Okay.
Yeah.
All right, good to know. So from here, what I want to show you is how you can actually adjust or add to your notes. So you can put your cursor anywhere in the note itself, and you can obviously make edits using your keyboard, but you're also able to click this little word for word dictation button, or if you've got the dictate anywhere function configured, then you can just hit your short key and you can dictate anywhere in the document and it will put text right in there. So in this case, I just press that button and that's what it did here. So you can actually dictate into the session. So if you use that dictate button or your hotkey, you can add additional text using your voice, but it will not regenerate the note. Now, what you can also do is you can click the resume button. And what the resume button will do is it will actually add additional context to your transcript. So we'll add it to the bottom of the transcript. And then what will happen is the note will actually regenerate. So that's really helpful. So for example, if we do things like, say, the patient's height was actually 175 centimeters and the weight was 75 kilograms. You'll see that it will update that section within your document. It's not actually doing that, but what it does do is it regenerates the note. And what that means is you're going to have to check it again. And if you made any changes, they'll be lost. So do be careful with that when you do use the resume function. I think it's you can see here the has updated these parts, but also some of these sections have slightly changed. So just be aware that every time you regenerate the note, the output actually slightly changes, and that's something to be aware of. And it is a feature of generative AI that it doesn't always give you the same output. But it's actually a useful skill or a tool to know that if you ever have any issues with note generation, with something not showing up, how you can help yourself. And so one of the key skills is you can actually click these three icons here and click the regenerate output button. It's like the same thing as the equivalent of turning it on and off again. And it does fix like 75% of all issues. Just know that you will have to check the output again, but that's the first thing you can try. Then if you still have an issue where your note is not showing up, the best thing you can do is press this copy session ID button. Again, how you get there is the three dots, copy session ID, and then there's a little question mark here on the side for the help button. Click on that, click on get support, then message, send us a message, and then copy in the session ID that you just got in the first step, and then explain what's wrong. So, I can't see my note, for example. And then you just send it off. And by actually giving it the session ID first, you save yourself an extra step, because if you just send them a message, then they will ask you what session ID it relates to, and that'll be another half hour until that happens, potentially. So this way, they've got everything they need and they can come back to you. You can just carry on with your work, do another session, and then if you once the help desk responds to you, it will just pop up. So that's really helpful. Now, I know that we're running short on time, so I do want to hand it over to the team, Alice and Katie, to share a little bit more about what you would have really liked to know at the beginning when you started using Heidi, what you think the team here should know. So I might start with you, Katie.
Thanks, Flo. So I've just made a few bullet points. So the things I wish I'd known is how to use the context box. The context box is like your friend for saving time for prepping for clinic letters. You can copy and paste information from a previous letter. You can upload a previous clinic letter or a referral letter. If you can't upload, you can use a clip and snip tool and take, you know, a screenshot and paste that into, copy and paste into that. You can then, if you've got bloods and you're looking, and you can generate a PDF from your concerto or whatever it is you're accessing your bloods, and you can upload it. So it is fantastic. It's really great. And it's also, if you've got multiple people in the consult, making, you know, you can say Mum Jane, Dad John, cousin Freddie, we're all there, and it will kind of pick up as to who's talking a little bit, which is fantastic. I wish I'd known that. Use the Heidi videos. They're really worthwhile watching. They're really, really easy to follow, and really self-explanatory. Templates are 100% your friend. It's worthwhile spending time in the template section, because the better your template is, then you will get more information as to how you want the setup. And when you're doing your templates, you can change the formatting, you can create tables. It is just amazing. And I wish I'd known about tasks earlier, so that, because out of a consult, you can then have a list of tasks of things that you are going to do assigned with each individual consult. And it's a really good extra note. So I don't make any notes at all during any of my consults. I use Heidi for everything now. I don't have any paper in front of me unless I'm trying to draw a picture to a patient. So I've moved on from doing a bit of backup to none, because my tasks are there, everything's there. It's an absolute game changer. So, and take the time to adjust your formatting with your templates, because if you spend time at the beginning, you don't waste time fixing things down the track, which then you're thinking, oh, I don't like the way it looks. So spend the time at the beginning setting up the template to look pretty. That would be my tips.
Those are awesome tips, Katie. There's a really, really great tips. And I know that we're running a bit short on time, but I'm happy to carry on. And maybe if you guys need to drop off, we will record the session. So I think we'll carry on a little bit longer beyond our time, because I think they'll be really valuable for you guys. Now, how about you, Alice? What would have loved to know?
Similar to Katie, spend the time at the start with the templates. Because I came along quite early in the Heidi setup, the template videos and everything I don't think were quite as good back then. So recently I've gone back, I've looked at everything that Heidi is now doing differently. I've updated all my templates again. Don't just set and forget stuff. It's quite dynamic. They're bringing out new features all the time. So it can be really useful even once every couple of months just to stop, have a little bit of a look at the other things that Heidi's offering. You can actually go into a set of it. I don't know if you can show Florian on there, but you can go into things that they're testing as well and have a bit of a go with those. Like I've just ticked for it to try personalizing my notes and making a kind of list of things and how I like to say them, what I tend to correct in my notes. So Heidi will do it automatically for me in the future. So it's always really interesting. Double check the information that they collect. The thing that I often find that it goes wrong with is if I've had the appointment and then I'm writing the letter like 2 or 3 days later, then I can find that it then will call my consult date the date that I'm writing the letter, as opposed to the date that it actually did happen. So always double check it. Evidence can be quite a good thing to use to double check any guidelines or best practice recommendations. Recently, I had an endo patient who wanted a full literature review of why an anti-inflammatory diet is helpful for endo at the cellular level and hormonal level in the body. So it did save me a lot of time being able to just ask Heidi for that, just double check it all, give it a bit of a search against other things that I've found and know, and then be able to collate that for the patient. So it can be very, very useful to help you with that as well.
Awesome. Thanks, Alice. I will pick up on that evidence one next, but I think it's probably quite a few other things that we still do want to touch on, and I think the main one is templates. So thanks for raising that first, Alice. I will touch on the other ones as well. So with templates, one really useful thing to know is if you type in Heidi Guides into Google, the first link that will come up is the Help Center. And then there is a course here called Level Up Your Templates. And if you click on that, you start with the basics. That's a really great place to start, learning about templates and how to set them up. And then you can go to the next level, which is the more advanced courses. There's actually four modules in this course. So definitely highly recommend that you do that. But let's have a look at a template, and maybe we'll use the one, Lynn, that you've put together, because I think it's a really useful one. So again, I'm going to go to the templates section in Heidi, and I'm going to look at this nutritional care plan enhanced note, and just clicking on the three dots to then edit this. So I want to briefly talk about just the building blocks of a template. Now, again, I showed you at the beginning how you can create one. What it does is it creates the structure here. And this is one, obviously, that's really well considered that Lynn's been working on for some time. But the main parts are any parts of the template that don't have a bracket around it, like this assessment or this pertinent history, this primary condition. We call those headings or section headings. And they're basically fixed parts of the templates. They're always in there. They'll be in there. Now, the square brackets, think of them as the what. We call them placeholders, but they're basically an instruction to the AI to put something specific that relates to the words inside the square bracket. So in this case, the primary medical condition or diagnosis, or prescribed medications relevant to the nutritional management, including drug name and dose. And this is actually the answer to a question that you haven't asked yet, which is, we get a lot, which is, how does Heidi know how to cut out the chit chat, the chat about the dog and the holiday? And the answer is only if there's a section in the template that is related to social history or like those kind of things, then yes, the dog and the holiday will show up. But it's actually, that's how Heidi knows what to put where, is through the what we call placeholder. Think of it as the square brackets, and then the parentheses or the round brackets is the how. So these are instructions, and the parentheses are really, really powerful. In this case, it includes control, saying only include if explicitly mentioned in the transcript, otherwise leave it blank. But you can use this in a variety of ways. So you could say, give me 7 sentences, less than 150 words. Write it in the style of Snoop Dogg. Don't do that, but it can be fun. Have it in an empathetic and supportive tone. Make it condescending and snarky. Don't do that either. But depending on the how, the output will come up quite differently. And so, yeah, I might hand it over to you, Lynn, now to just maybe take the team through some of the elements of this template, and we go a little bit deeper into it.
Yeah, thanks, Flo. Well, this was an attempt to really make a fairly full template to actually, as I called it, enhance the NCPT. There's some basic ones that were available, DIME ones that were available to look at. So there's a couple of things that I'd like to point out. You'll see here under blood pressure, I put leave blank because I actually do like to capture that. So if it's not mentioned in the session, I will add it in later because it will still put not reported or something like that. Whereas if you want to have it omit entirely, you put omit entirely and it just won't mention it. So that was the first key thing. And then scrolling down a little bit, yeah, so if we look at, I actually probably, yeah, we come back to that. Initially, before the actual consult, I like to ask the patient's perspective on why they're coming today. So you can put in things and give it some context to actually capture what you're talking about. So I think it's in here. Yeah, there we go. So I put in things like giving it the context of the main questions, concerns, priorities. And that actually is really helpful because often why the doctor might have referred them is different to why the patient's there. So you can pop in extra bits like that into your template. Now moving on down to anthropometry, for example, I've actually put leave blank for both the height and the weight, just in case, because I want to add it in later. That's another one. Otherwise, you put omit entirely. Now, the next thing is biochemistry. Now, I've put in here instructions for a table. And I like to put the labs in a table, and I think that's a really great thing about Heidi. You don't get higgledy-piggledy stuff coming out. So that's an option. Scrolling down to physical findings, you'll see that I've added in quite a few things that I really would like Heidi to capture so that it doesn't leave them out. Then going down to food and nutrition related history, I've been quite prescriptive in what really I'd like captured in those sections, so that and also put, you'll see for I meant to take it out because in actual fact it shouldn't have right and full sentences for that one. It should just be listed, because otherwise you'll get a little narration.
I'll fix that for you.
So there you go. Thanks, Chloe. Now I like to do a summary, and I've prompted it because I think sometimes that's good enough just to send to the doctor, which captures a lot of what the actual diet history actually showed. So that's something else you can add in. Scrolling down to the next section, which is patient's perspective again, in terms of just before the nutrition diagnosis, the self-management motivation. You can actually, if you write it correctly, you can capture the score for actually if you ask people how they rate themselves, or if there's a general conversation about it, actually it writes a very good comment about their confidence and importance. Now, the nutrition diagnosis, just like to quickly mention that, because that's a tricky one, because Heidi does its best effort here, and some people like to leave it out because they would rather do their own, or think it's more clinically appropriate to do that. I've actually tried my best to get it to improve its skills. You'll see I've put use only NCPT, standardized terminology, without codes, because I started to get codes beside them all for some reason. So, but I'm hopeful that over time that with actually having NCPT and SNOMED, that we'll actually get really cool diagnosis codes coming in here. But also I've given it a bit of context in terms of how perhaps it should actually format that, and so it's pretty good, and often it needs just a bit of tweaking, but that's one thing that's up to you whether you leave in or out. Now, just lastly on the nutrition intervention, and that's where I've been very specific with trial and error to get the right things in the right section. So instructing Heidi to actually give the patient-centered goals that you've discussed with the patient. Secondly, the nutrition prescription, making sure you don't get a whole lot of food advice in there. You'll see I've put in there, do not include food-based recommendations. And so for these sections, it's more about telling Heidi what you don't want to go in there, because then it gets a very clear message of what you are expecting in each of these things. So scrolling on down, I've done that for the interventions under the different sections as well. And I've tried it out with my more specific CKD and kidney stones one, and it's pretty good. And you'll see I've put right as a bulleted list, because you don't want a whole lot of narration coming out. So, and then just finally down to the monitoring and evaluation. I'm pretty keen on this because I think it's really helpful for a reassessment to pull out those indicators. So I've actually given it some context as to what I consider that to be. And it, you know, I think Heidi learns what you want, and it actually has really helped me clear up this section of my template actually, and I trial it with a patient that the transcript of a patient that I might have used just to fine tune it. So there's a lot to actually do with templates, and I found actually working with it in more detail and getting it right, as Katie said, and also Alice, is just such a cool thing, because then it just flicks in, and things are just really fantastic. So we'll leave it at that, I think, but happy to share that when we've actually finally fine-tuned it. So if anyone's keen.
I think you definitely should. And the way you would do that is by settings, sharing, and then you can send it to the template community here. So you can submit it, and then it'll be available in the public template community. And I think you definitely should do that. Now, just a couple of points there, and Lynn, that's amazing. A really great template. So you might see me flick backwards and forwards between the example and the structure. That's actually a really good way to tweak it the way that you want to, because you can make changes here and then just click back to the example and you can see how it changes the output. So that's really helpful. And just know also that you can just prompt Heidi to make any changes. So you could ask it anything, and you can use AI to help you prompt it. I know that some dietitians also use other tools to actually create templates, such as Claude or ChatGPT. There's actually a custom GPT for creating Heidi notes, but again, Heidi has got the prompting feature inside it as well. But not sure if Katie or Alice, if you got anything to add around that. No.
Lloyd, would you just ask Heidi for a patient explainer for this patient?
Sure.
Please.
Just going to get rid of those changes, and I might. Okay, that's the one that we did. So this is the Ask Heidi Anything bar, now called the evidence feature. In this case, we're not actually trying to look at too much additional information. It's just a patient explainer. It will actually, I think the way I set it up right now is I've got some sources selected. If you don't want any additional source, you just want it to be about the actual setting, you have to turn these off. Sorry, I've got a couple selected.
Because we didn't do any intervention, it's going to be a pretty short patient explainer unless it draws it from somewhere else. But fine.
Yeah, no, that's fine. So go. Just pulling it together. I'm going to create it as a document anyways. So I'm going to create it as a document. What happens is then it adds it to what we call the ribbon here, and it gives a little bit more space so that we can have a look at that one here. And so this is the patient explainer. I think that's really, really helpful. Again, you could make the prompt a little bit more explicit. So you could, for example, say, create a patient explainer at 2nd grade reading level in an empathetic tone, and it will come out slightly different. Or keep it to less than 200 words, or ensure safety netting advice, or something like that. And then really good to know, as well as with the Heidi Evidence bar, there are shortcuts inside the evidence bar itself. So you can go into these shortcuts and you can create some for yourself. If you click on see all shortcuts, then you can create one for yourself. And so, for example, you can create one that's an explainer, and you can then have your prompt, the one that you like. Let's say, create an email to the patient explaining any key points from the visit in an empathetic tone. And then you can put a description, you save it, and now next time that you want to use it, you just, the moment, sorry, it's here, I'll bring it back to where it was. You can just click on the shortcut icon, and then you just click explainer, and you don't have to even write the prompt. It will just automatically do it for you, and then it will work that way, which is really helpful. Now, I know we're 15 minutes over time. Team, do we think, shall we call it for now, or do we go quickly talk about evidence?
Any questions, maybe? Top questions.
Maybe we can also let people, see if we can let people unmute themselves. You'd love to talk about evidence? Okay.
Okay.
Yeah. All right, perfect. No, that's good. All right, so there's two main ways that you can use evidence. One is within the session context, which is what we've been doing here. And so you can ask, edit, or create anything, but it's in relation to this particular patient. You can also ask it a general question by clicking on this evidence tab, and that allows you to ask any generic question. Now, if you want to bring in patient context, you can still, because you can actually link a visit or a patient or add any kind of other information or a file. And this is also really useful, again, to interrogate, for example, medical history or other things. You can bring this into the context, and then you can ask any questions such as, what were the medication changes over the past 2 weeks or something. Now, there are two versions of evidence. There's a free version and a paid version. With the free version, you get 10 in-session evidence calls per month. So that means within the session itself, you can ask a question about the patient within the context 10 times per month. It doesn't relate to things like asking to create a patient explainer. That's not limited. It's actually when you ask a question where it looks for evidence itself. Now, with the paid version, you get unlimited of those, but also it allows you to add your own source documents. So you can add any kind of documents, policies, procedures, guidelines, and web sources. And you can also set as a team level. So that's a difference between the paid version and the free version of evidence. With both, you do have automatic logging of CPD hours. So as you're looking at information, actually it tracks your usage, and then you can export that and bring it and use it for your continuous medical education needs. But maybe if we can, Alice or Katie, could you give me a question that we could ask?
A question to ask about for evidence.
Yes.
Can you tell me the most appropriate magnesium supplement for sleep?
Okay. Again, you can select your sources. In this case, I've got a couple of things like Healthify and BPAC selected, but maybe I'll just go with the clinical web and literature and guidelines. Again, we will have quite a few more partner sources coming soon, such as Health Pathways. But in this case, I'll just do that. And then what Heidi Evidence does is it actually searches through all the available sources. It can't actually make up a source. So sometimes with a large language model, you get the issue that it hallucinates a source, but the architecture only allows it to provide evidence from actual sources, and it uses an algorithm. So it ranks the sources based on the quality of the research. So this is like a peer-reviewed study with a randomized controlled trial, or is it like something simpler than that? Then the quality of the source, like the Lancet might be more trusted than Wikipedia, for example. The applicability to your specialty. So is this from a podiatrist or is it from a dietitian or from a dietetics background? The recency and the geographical distance. Is this from Azerbaijan or is it from Australia? But there we go. So see, it found 53 sources. In this case, a lot of this is from overseas. I would have liked to see more New Zealand sources. But what you can see is you can click into any of these sources, and it will actually take you straight to the actual source itself. you can find that. It references the sources inside the key points. And what do we think, Katie? Is that about right?
Yeah, it's great.
Okay. So it is actually something that you can keep prompting. So you could ask any kind of follow-up questions. So that's been really helpful. Again, there's a lot of different things that you could do with this. So for example, if I just go and ask a new question, it does give you some examples. So you could get like advice on any interactions between maybe supplements and medications. You can look up something in documents that you upload. You can calculate risk scores. It has got some actual medical calculators in there. So for example, like for pediatric dosing, there's a specific calculator in there. There's a lot of under the hood functionality once you get started with it. It's really useful. Again, you can do things like creating patient summaries and handouts, medical certificates, and you can also get it to fill in forms, which is really helpful if you link it to a session. So probably something for another day. Any other questions, team?
I know a question's been asked, which has been answered already, but I think from a cost perspective, just generally, what's the main differences in features, not just with evidence, but with features between paid and the free version, if you were using it in your clinical practice for transcription?
Yeah. So the main difference between the free version and let's say the clinician version, which is the individual version for one person, is one that you're limited to 10 sessions per month using a custom template. So what Lynn's put together, a template like the Advanced Nutritional Care Plan template, if you want to use that as an output, with the free version, you're limited to trialing that. You can use the provided free templates and you can use it as often as you like, but really if you want to use it in earnest and you're doing more than 10 sessions a month, that's where you're going to run into a limitation, and that's, it's by design. The free version is not free because you are the product and we're selling your data. It is designed to be a freemium model, which is get you started enjoying it, and then over time that you see other cool things that you would like to do, and there's the paid component of that. So the first one is you get 10 credits, we call them pro actions, to use templates or to use the Ask Heidi Anything feature, the evidence feature, yeah? So that uses up 1 credit each time that you use that. Also, if you want to create like a patient explainer, that uses up 1 credit. So if you want to create a secondary document, it uses up a credit, and you only have 10. Secondly, you don't have access to the best scribe model, only the fast scribe. And actually for like dietetics context, you typically have very long sessions, and the best model is definitely a lot better because it has a larger context window from a technical point of view. So it does a much better job. So you get a better result. The third one is around priority note generation. So sometimes in the early afternoon, if you're on the free version, when Australia comes online and there's a bit of load, it can take a little bit longer to get your note back on the free version versus with the paid version. You've got priority note generation, which means that typically it renders within less than 15 seconds, typically less than 10 seconds. There's difference in sort of support times, but I think it's marginal. But I think those are the main ones from a clinical point of view. Now, the difference between the clinician or the free version and a practice or enterprise version is really in the organizational ability to enforce governance controls and to share templates to ensure that everyone follows the right settings. And it's quite different from a support motion. So the clinician version and the free version is a self-service thing. You put in your credit card or not, and get yourself set up, watch the online video, off you go. For the practice version or the enterprise version, like you work with my team. We have customer success leads. We do kickoff meetings. We do in-person or remote trainings like these for your team. We provide you with ongoing metrics to help you drive uptake across your organization. You have unlimited access to the Heidi template support team, which actually helps build these templates for you and refines them for you. Again, if you've got the skills like Lynn, then you don't need that. But for some of you, and like, you know, let's say we're talking about hundreds of clinicians at Health New Zealand, then you do want to have that hand holding and that support. So that's quite a big difference, obviously, in the approach and the support around it. So yeah, hopefully that explains it.
Yeah, I think like I know that I did the free version and then went very quickly to the clinician version, having had the business version, whatever you want to call it. What do you call it? The organizational one. Practice one. And yeah. If you want to use Heidi really well, and especially if you're a sole trader or a sole practitioner, the paid version is worth its weight in gold.
Great. Do we have any other questions, team? I know we're half an hour over time. Apologies for that, but I think it's because everyone's interested. I see that you guys are still here, so that's a good sign, I reckon.
Yeah, no more questions in the boxes.
Okay. Well, in that case, I think it's a perfect time to wrap it up. I really want to just say a big thank you to Alice, to Katie, and to Lynn for sharing so richly of your experience. I think it's been really, really great. Thanks so much for taking the time as well. I know that you guys had a really busy caseload today, so that's awesome. And hopefully it was useful to all of you. Again, we will share the recording of the session with all of you. If you had to leave early, no problem, then you'll be able to see what you missed. And we're definitely open to any follow-up question. Lynn, what's the best way for the participants to get those questions to us? Should we give them our email, or are we happy to like route it through Dietetics New Zealand? Any advice?
Well, probably to your email in the first instance, but you might like to share that you are speaking at the Dietitians conference in September.
Yes.
And also maybe we may be able to persuade you to run a follow-up session at some point to focus a bit more on the more advanced features. Yeah,
I would love that. Thanks for reminding me, and I'm looking forward to that and spending time with all of you in person. And look, I again so grateful to all of you. It's been fantastic learning from you as well, Lynn, with all the work that you've done, and hopefully this was all useful to the audience and all of you. Appreciate you. Have a lovely rest of your afternoon. Mā te wā.
Thank you.